Here we have a brow lift procedure using Vsoft Lift PDO lifting threads. You can see the injector has marked out their treatment plan accordingly, using 2 vectors that they're going to use to achieve a lift sort of in the arch of this patient's brow. And she currently is using a 22 gauge needle in order to create a point of entry. Following that, she's going to provide local anesthesia using lidocaine, and then will use her PDO thread in that particular vector. So she is using a 50 millimeter 25 gauge cannula here to provide local anesthesia. And you can see she's sort of fallen into that same tunnel that she used where she created her point of entry to provide a little bit of anesthesia here. In general, for a brow lift, or any lift really, the more lidocaine you flood the area with, the less of a pull you're going to get. So when we're thinking of such a small area, such thin skin that tends to be pretty tightly bound, you want to use the least amount of anesthesia as possible. And so she's going in to provide a little bit of lidocaine so that the patient's comfortable, but not too much that she's not going to achieve the lift that she wants. And you can see in this area, you do get pretty immediate swelling. And again, that tissue is very thin on the forehead. It's bound pretty tightly. And so you can get that reactive swelling right away. The good news with this area is that the swelling resolves very quickly. Usually by the next morning, there's dramatic improvement. So they are using a 21 gauge by 60 millimeter PDO lifting thread. This particular instance, she is using a sharp tip cannula. I tend to like using a blunt tip cannula for these procedures because you tend to get less bleeding and less swelling. You always want to be very careful to avoid the frontal branch of the superficial temporal artery here. So generally prior to starting, you're palpating, feeling for a pulse, and using that as your landmark of where we want to avoid. When you go in using a blunt tip cannula, there's less of a chance of nicking that branch of the artery, which results in a pretty good goose egg or a hematoma. Again, it does resolve fairly quickly, but if we can avoid it, it's all for the better, of course. So again, we're following these vectors here, placing our 21 gauge by 60 millimeter threads, and you can see it's going in pretty nicely. And then she's going to remove the thread, the cannula, and look at that nice lift she's achieved in the brow. Always we want to engage those threads into the brow. And so you generally just sort of run your fingers over the tissue to make sure those barbs have engaged. If you can appreciate, there's a bit of a crinkle above the patient's brow, which resolves generally within the first couple of days. That's a good sign. That means that you achieved a really nice lift. And so you sort of want that crease there, but just make sure you educate your patients and let them know this is expected, and over the next couple of days, it will fall and relax nicely.